Hello, this is my brochure about the benefits and drawbacks of microdosing psilocybin for mental health benefits. Psilocybin is derived from mushrooms and is classified as a Schedule 1 psychedelic. It is usually referred to as shrooms, magic mushrooms, or just simply mushrooms. Microdosing for mental health benefits is different than recreational use because microdosing is typically 10% of what an individual would consume in a normal dose, and microdosing is intended to enhance the functions of the mind rather than completely distort your perception. A lot of people say that they feel a lot more creative and focused, and it's easier for them to empathize with others while they are microdosing. And microdosing typically involves a schedule. So the most popular one is once every 3 days, and the idea is that you take it once on the first day and then you have the residual effects for the next 2 days before you take it again. Recreational use is a lot less structured. You just kind of take it whenever you feel like it. Why would you microdose? It has the potential to help with headaches, migraines, anxiety, end of life anxiety, treatment resistant depression, moderate alcohol disorder, PTSD, OCD, and anorexia nervosa. How long until there are noticeable benefits? Everybody's different and it varies from person to person. A lot of the information we have is anecdotal evidence, and people typically say that it takes a few days to a few weeks before they start seeing benefits. Is microdosing a long term treatment option? There is currently minimal research on long term effects. Therefore, at the moment, it would not be recommended as a viable long term option. Some of the potential adverse effects include worsened mental health if you were to have an adverse reaction, hallucinogen persisting perception disorder, which is when you take a hallucinogen and even after the high has passed, you still have some of the symptoms like visual hallucinations. Another risk is psilocybin dependence. Eventually, if you take it for long enough, you would start to feel like you aren't as creative or you aren't as focused or you didn't feel as well. And it would become habitual rather than being an every now and then thing, which, just to note at the moment, we don't know how it should be used. The last risk is psilocybin tolerance. So, just like with any other medication, eventually your body will build a tolerance to it and you'll have to keep upping your dose. And at a certain point, it won't be a microdose anymore. You'll be taking a full dose and then you'll actually trip, which completely defeats the purpose of microdosing. Can microdosing be done without the help of a professional? No. A lot of people will do it because, as I said, most of this information is anecdotal evidence, but it's not recommended due to legal and safety concerns. Psilocybin is a Schedule 1 drug, therefore it is illegal, and because of its illegality, there are safety concerns. You don't always know where it's being sourced from or what it's been laced or contaminated with, so for that reason, you should always do it with a professional. Are there any occupational risks that come with microdosing and psilocybin? Yes, as I said, it is a Schedule 1 drug, it is illegal, and the Americans with Disabilities Act does not protect you from a positive drug test at your place of occupation. The testing windows are relatively small, so for a urinalysis, could only be detected for up to 24 hours, and with the hair test, it could be detected for up to 10 days. Research on the benefits of microdosing psilocybin is still in its infancy. We don't really know a lot of the information that we do about other mental health treatments, and it's really important to talk to a medical or mental health professional before deciding if microdosing would be a good choice for you. Also, when people refer to microdosing, It could either be psilocybin or LSD. All of this information is only about psilocybin. I cannot attest to whether any of this is accurate for microdosing LSD. Thank you. These are my resources, my references.